What you do during the first hour after waking up may matter more to your kidneys than you realize. From what you drink to what you eat, and even some medicines you may take, ordinary morning habits can sometimes work against kidney health. Today, we're looking at 6 habits worth reconsidering after 50, and the first one is probably the most common. Your kidneys filter waste from your blood, help balance fluids and electrolytes, and perform several other important jobs. But kidney health isn't determined by one morning or one meal. It's your overall pattern of habits, health conditions, medications, and lifestyle that matters over time. And one important warning: none of these habits automatically means you're damaging your kidneys. Some may only become a concern when they're frequent, excessive, or combined with other risk factors. So let's start with the morning habit that sounds harmless, but can become a problem when you regularly begin your day without replacing the fluids your body has lost overnight. After several hours of sleep, it's normal to wake up having gone without fluids for a while. Your body continues to lose water through breathing and normal overnight processes. For most healthy adults, simply drinking some water in the morning can be an easy way to rehydrate. Your kidneys constantly filter your blood and help regulate the body's fluid balance. When you're dehydrated, your urine may become darker and more concentrated. That doesn't mean dehydration automatically causes kidney damage, but staying adequately hydrated is an important part of normal body function. But here's something important: you don't need to force yourself to drink huge amounts of water just because you heard that more is always better. Fluid needs vary depending on your body, activity, weather, diet, and medical conditions. Some people with kidney or heart problems may even have specific fluid restrictions. So the goal isn't to follow a magic number. It's to pay attention to your body's needs and follow any fluid guidance your healthcare professional has given you. And once you've had your morning water, there's another common habit to watch: the breakfast sitting in front of you. That breakfast may look harmless, but sodium can add up quickly, especially in processed meats, packaged foods, sauces, and heavily salted meals. Your kidneys help remove excess sodium from the body, and consistently high sodium intake can contribute to higher blood pressure, which is an important risk factor for kidney disease. When you regularly consume more sodium than your body needs, your body retains more water to help maintain balance. Over time, a high sodium diet can contribute to higher blood pressure in some people. And that matters because high blood pressure can put extra strain on the blood vessels inside the kidneys. The biggest problem is that much of the sodium we eat doesn't come from the salt shaker. It can already be present in packaged and restaurant foods. Checking nutrition labels and choosing more fresh, minimally processed foods can be a practical way to reduce sodium intake. And remember, sodium needs aren't exactly the same for everyone. If you have kidney disease, high blood pressure, heart problems, or another medical condition, your healthcare professional may recommend a specific sodium target. But sodium isn't the only thing people sometimes take first thing in the morning. For some adults, another routine involves medication, and one common category deserves special attention when it's used too often. A headache, backache, or sore joint can make it tempting to reach for an over-the-counter painkiller. But some commonly used pain medicines, particularly NSAIDs such as ibuprofen or naproxen, can affect kidney blood flow, especially when they're used frequently, at higher doses, or when someone is dehydrated or already has kidney problems. Your kidneys receive a large amount of blood flow, and certain NSAIDs can reduce the production of substances that help keep kidney blood vessels open. In some circumstances, that can reduce blood flow through the kidneys and make them work harder. The risk can be higher for some people, including those with chronic kidney disease, dehydration, heart failure, or certain other medical conditions. That's why regularly using painkillers shouldn't become an automatic morning routine without discussing your situation with a healthcare professional. And this doesn't mean you should stop a prescribed medicine on your own. If you regularly take pain medicine or several medications, ask your doctor or pharmacist whether they're appropriate for you and whether your kidney function should be monitored. But medications aren't the only thing that can quietly change your kidney workload. The next habit is hiding in a place most people don't think of as a kidney health issue at all: your breakfast plate. Because what you regularly put on your breakfast plate can influence more than your calories. It can also affect the overall quality of your diet. A quick packaged breakfast can be convenient, but if most of your mornings begin with processed meats, packaged pastries, instant foods, or heavily salted cereals, your overall diet may end up higher in sodium and added sugars and lower in fiber and fresh foods. Over time, that pattern may be less supportive of overall kidney health. For kidney health, the overall dietary pattern rather than one specific food. A diet that frequently contains excess sodium can contribute to higher blood pressure, while a more varied diet can provide fiber and other nutrients that support overall health. You don't have to make breakfast complicated. Swapping some processed foods for options such as oats, fresh fruit, vegetables, unsalted nuts, or eggs can be a simple way to build a more balanced meal. Your exact choices should still take into account your kidney function and any dietary restrictions you have. And here's an important distinction. A kidney-friendly diet isn't identical for everyone. People with chronic kidney disease may need individualized guidance about sodium, potassium, phosphorus, protein, or fluid intake. So don't copy a restrictive diet from the internet without knowing what your own kidneys need. But there's another morning habit that can be just as easy to overlook, skipping a proper meal and relying on coffee or convenience foods instead. And that brings us to habit number 5. The problem isn't simply skipping breakfast, it's what that habit may lead you to eat and drink for the rest of the morning. Skipping breakfast by itself isn't automatically harmful to your kidneys. The bigger concern is what happens afterward. If skipping a balanced meal regularly leads to highly processed foods, excessive sodium, sugary drinks, or an unbalanced diet later in the day, the overall pattern may be less supportive of your health. For kidney health, the focus should be your overall eating pattern, regularly choosing foods with less sodium and added sugar, while including vegetables, whole grains, and appropriate protein can support a healthier dietary pattern. And if you already have kidney disease, your ideal diet may be more specific. Depending on your kidney function, a healthcare professional may recommend changes to sodium, protein, potassium, phosphorus, or fluids. So don't worry about following one perfect breakfast routine. Think bigger. What does your usual diet look like across the whole week? That's a much more useful question for long-term health. But there's one more morning habit that may matter even more than what's on your breakfast plate. It involves a number that many adults don't feel at all, and that makes it easy to ignore. You can have high blood pressure without feeling a thing, and over time, that silent pressure can matter to your kidneys. High blood pressure is often called a silent problem because many people don't notice any symptoms, but your kidneys contain a huge network of tiny blood vessels, and consistently elevated blood pressure can damage those vessels over time. That's why knowing your blood pressure can be an important part of protecting kidney health. Your kidneys rely on healthy blood vessels to receive and filter blood. When blood pressure stays too high over time, that pressure can strain and damage the small blood vessels and filtering structures inside the kidneys. And the relationship works both ways. High blood pressure can contribute to kidney disease, while kidney disease can also make blood pressure harder to control. This is one reason regular monitoring becomes especially important as we get older. If you already take blood pressure medicine, don't stop or change it on your own just because you feel well. Medicines work differently for different people, and your doctor may adjust your treatment based on your blood pressure, kidney function, and other health factors. So the 6 habits we've covered aren't about being perfect. They're about paying attention, staying appropriately hydrated, watching sodium, using pain medicines carefully, choosing a balanced diet, looking at your overall eating pattern, and knowing your blood pressure. And remember, one breakfast, one salty meal, or one morning without enough water doesn't automatically damage healthy kidneys. Kidney health is influenced by the bigger picture: your blood pressure, blood sugar, medications, diet, hydration, existing health conditions, and habits over time. If you have kidney disease, heart disease, diabetes, or another medical condition, your ideal diet and fluid intake may be different from someone else's. Personalized medical advice is always better than a one-size-fits-all rule. If you want more practical, evidence-aware health information for healthy aging, subscribe to VitalBites and tell us below, which morning habit are you going to pay more attention to from now on? This video is for educational purposes only and does not diagnose or treat kidney disease. If you have persistent symptoms, abnormal blood pressure, known kidney problems, or questions about your medications or diet, speak with a qualified healthcare professional.